Namaste. Welcome to Muhurta Yoga, Dr. Mayurvkaku channel. Today is World Spine Day 2021, and the theme is back to back. Means we are coming back to the back. That is nothing but spine. Today we are going to understand what exactly is going on with spine, what needs to be done with the spine, and how we can remain healthy from the disorders of spine and stay away from the disorders of the spine. We all know here that basically we are all four-legged animals. However, we, because of evolutionary process, became two-legged animals. And because of that, there are some changes which have happened in our posture, and because of that, we are all vulnerable to many disorders of the spine. So all of you are most welcome here on this platform, mayurvkaku, the YouTube channel. Today we are going to discuss about spine, its issues, my experiences, your experiences, and through that we will evolve into better caretakers of our own spines. Hari Om, Suprabhatam, Suprabhatam, Om. Now, we are going to start our basic meditation, which we do. After that, we will have both the things, yoga session as well as awareness program. With each practice, I will be discussing something, or with each discussion, I will be showing some demonstrations. Many of you are knowing this channel for a long time. Many of you might be new. So for those who are new, I am Dr. Mayurvkaku. I am a neurosurgeon. And in addition to being a neurosurgeon, I have been practicing yoga since my childhood, with the help of which since last almost 20 years, I have been teaching yoga and helping people to improve their health without any medicine or any surgery. So despite being a surgeon, I try to help them without surgery. So with that understanding, sit comfortably, back erect, neck erect, eyes closed, gentle smile on your face. Forget all the tensions and worries and focus only on your breathing. When we inhale, the abdomen is bulging. When we exhale, the abdomen is sinking down. With each breath, we are becoming more and more relaxed. Slowly, we see that when we inhale, cool air is going inside. When we exhale, warm air is gushing out. With each breath, we are becoming more and more relaxed. With each breath, we are becoming more and more relaxed. Slowly, let us focus on the center of the eyebrows. When we focus on the center of the eyebrows, let us visualize one Omkara of any size, of any shape, of any bright color. While focusing on this Omkar, we are going to chant it 3 times. Om. Feel the effect of Pranava Omkara on your mind and body. Slowly. Let us adopt Namaskara Mudra. Omkar followed by Sahana Vavatu. Sahana Vavatu. Sahanao Bhunaktu. Sahaviryam Karavavahai. तेजस्विनावधीतमस्तु मा विद्विषावहै ॐ शान्तिः शान्तिः शान्तिः. With your eyes closed, slowly take your both the hands back. Hold your right wrist with the left palm. Inhale, arch your back, look up. Exhale, bend from the root of the back.
Touch your forehead to the ground. Express gratitude to Mother Earth, Almighty, your parents and Guru.
Slowly inhale and come up. Slowly release your hands. With few blinks, you may open your eyes. Suprabhatam. Once again, welcome to our Brahma Muhurta Yoga. And today's theme is World Spine Day 2021, back to back. Now I am going to share a screen and you can, yes, this was the flyer. This is the flyer which you can still share, and you can invite your friends and family on this. Right now, if not possible, you can share this video. This video will be available on this platform. So basically, whatever I am going to show here today, already I have discussed many a number of times on our platform, and we all have fruitfully discussed umpteen number of times. But still, for new people, for those who forget, for them, today once again we will discuss. So this is me, you can see here. I have been practicing with support of the wall. Okay, so this plus very simple standing practices we will do right now. This was done during the time of Corona lockdown. We all started in the initial phase. I was taking pictures like this and was posting on Instagram and challenging our fellow human beings and keeping them engaged in yogic activities where they can improve their posture and at the same time forget about the suffering which was going on because of Corona. Today is World Spine Day, back to back. Now we are going to do some Tadasana related practices. Okay. This I am doing with the support of wall deliberately because it's very important for all of us to understand that our spine needs realignment. Okay. So what we can do is take our full body close to the wall, touch the heels to the wall, put the feet together, great toes together, spread other toes, and feel the distribution of weight evenly across the spine, across the feet. Now, when we press our ankles against each other, automatically the lower limb muscles, they will start becoming tight. Now exhale and suck your abdomen in. Inhale and expand your chest. Hands by the side of the body, looking forward, gentle smile on your face. This is called as Tadasana. Now normal breathing you can do, but try to keep the muscles engaged. And when we have done like this, try to keep maximum body parts into contact with the wall. So the posterior aspect of the head also will be in contact with the wall. Shoulders also will be in contact with the wall. Upper back, middle back, like that. Hips will be in contact with the wall. Now this is Tadasana. Tadasana helps a lot in correcting the posture. Now interlock the fingers, touch your thumbs against each other. Inhale and take your both the hands up. If possible, lift your body on your toes. Exhale. Inhale. Exhale. Do it repetitively and bring awareness into breathing and movement. At the same time, observe what changes are happening in these muscles. Inhale. Exhale. 2 more rounds will do. Inhale. Exhale. With each practice, we should become more and more aware of our body parts. Inhale, last round this is. For Urdhva Hasta Tadasana. Exhale. Release and relax. So now this is about straightening of the spine. Further correction, which I was showing in the first slide, no? That thing I will show you. For that, I will shift the camera to this side, and there I will show you what needs to be done. So you can see here, I am standing close to the wall. My toes are touching. And then gently, I have lifted my chin and I have put it on the wall. So just by resting on the wall like this, you will observe many changes. Na hathat, na balat. Anything whenever we do in terms of yoga has to be done in a very relaxed manner, comfortably. And if you find any difficulty If you feel you are not comfortable, try to seek advice, try to seek help. Now gently interlock your fingers. You can project your index finger straight and then slowly straighten your upper limbs. Slowly with inhalation, you can lift your upper limbs straight up. And chest expansion, exhale. Collapse the chest, collapse the shoulders. Like this. Inhale gently. Exhale. You will observe subtle changes in the neck, in the upper back, and overall in chest region, shoulder region. One of the biggest reasons for problems is drooping shoulders and inward going chest for bad posture. Now we'll do another 2 rounds. Inhale. Exhale. These practices have to be done very, very gently. Inhale. Exhale. Observe how much ever you can do, that much. One more round will do. Inhale. Exhale. Release and relax. Slowly, slowly, very, very gently come out from the wall. Very, very gently. Now, as you saw, this is a compensatory mechanism for. So now we will sit for a while. This is a compensatory mechanism for what we do on our mobile, like this, neck forward bending. What do we do on our laptop? Neck bending forward, drooping while reading books or while using multiple number of pillows. So for that, your companion is your wall, and you can correct how you are feeling. If you have practiced how you are feeling, you can mention in the chat section. I'll be more than happy to acknowledge your experience. Now, let us move forward and understand more about the spine on this World Spine Day. Okay, here we go. So, we all know that medicine and surgery for spine disorders is well described and it's well available. But those who suffer, they know that medicine and surgery is not all. And those who, many of you think that I am a yoga expert, but in addition to being a yoga expert, actually I am a surgeon. And you can see here a surgery performed by me. And this was the situation before surgery. This person had tuberculosis of the spine, and now it is straightened. And not only that, with the help of integrating the
ಎರಡು ಕೈ ಮೇಲೆ ಮಾಡಿ 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 ಎರಡು ಕೈ ಮೇಲೆ ಮಾಡಿ ಆಗಲ್ಲ ಏನಾಗತ್ತೆ ನೋವು ಆಗ್ತಾ ಇದೆಯಾ ಸ್ಟಕ್ ಆಗಿದೆ ಓಕೆ ಕತ್ ನೋವು ಇದೆಯಾ ಒಂದೊಂದು ಸಾರಿ ಬರ್ತೈತೆ ಸ್ವಲ್ಪ ಹಿಂಗೆ ನಿಂತ್ಕೊಂಡು ತೋರಿಸಿ ನಿಂತ್ಕೊಡಿ ನಿಮ್ಮ ಕಿರಣ್ ಅವರೇ ಹೇಳಿದಾರ ನಿಮಗೆ ಎಲ್ಲ ನಾನು ಪುನಃ ಹೇಳ್ದ ಅಥವಾ
I would like to share one experience in which you will understand that it's not the fault of doctors. It's just one kind of unconsciousness. That is what I described many a number of times, that we are all collectively unconscious of many things, and we need to come together and become more and more conscious. For example, this is the review. The review system was put by this person. She's a doctor, and she is in our hospital, and she brought her mother for knee replacement and the spine issue. I consulted Dr. Mayurvkaku for my mother's neurological problem. She had radiating pain, but surprisingly, he said that he could help her without surgery. So he taught her relaxation techniques and asanas. I was shocked to see my mother bend her knees, which she hadn't done for past 8 years. And she reported immediate relief of her pain, about 60%. He used holistic approach and gave advice on diet as well. Now she continues to do the asana protocol given to her every day and has complete pain relief. Thank you, Dr. Mayur. Now, this was a doctor's experience, and when this happened, she was like, "Arey, why are you making my mother lie down on the floor? She has not been sitting on the floor since last 8 years. She has not sat down since last 8 years. What will happen to her knees? Already she's due for knee replacement and spine surgery also. And for spine, she had come to me for second opinion. Now this is what happened, and even today also, her mother has not undergone any surgery of knee or spine. So that is the power of yoga. That is one thing. Another thing is that after this, she liked the way the holistic approach is, and she was recommending many other doctors that, okay, you should see what Dr. Mayur is doing. And one day what happened is, one of the surgeons, he was limping because of sciatica, same problem. He's a very tall surgeon, very hefty, and he was limping. She asked him what happened. He told, I am going to undergo surgery day after tomorrow. I have sciatica, and one of my other hospital's partner is also a neurosurgeon, and one of my neighbors is also a neurosurgeon. Both of them have advised that surgery is required, and I'm going to undergo surgery day after tomorrow. Now, what happened is, she told that, I think you should meet Dr. Mayur. He helped my mother a lot, and my mother is absolutely fine. This was after like almost after 2 months after mother recovered. So he like was a bit hesitant maybe. So instead of meeting me, he just saw my videos and he thought that, okay, this can be done, and he just followed through the videos, and he recovered. After 2 months of him recovering, when I was operating on one small child, he came and he told, good morning, Dr. Mayur, how are you? And he's senior to me. He's like maybe 15-20 years senior to me, and I was surprised that he visited my operation theater. I was very happy. I told, sir, this is a pediatric neuroblastoma case, and then I'm doing the biopsy now, and like that we discussed, and then he told, Dr. Mayur, I would like to thank you. I told, sir, for what? No, the kind of work which you are doing, and because of which I got motivated, and I was due for surgery. And then he mentioned about his neurosurgery neighbor and neurosurgery partner, and he told that, Dr. Mayur, I have a question. Both of them are quite accomplished. They are very famous. Then how come they advised me for surgery? I am their colleague. I am their neighbor. How come they advised me for surgery? I told, sir, it is not their problem. It's not about them. It's about our collective unconscious. And it is because of that, many a number of times people are not aware that there is a possibility of recovery from yoga. There is a possibility of recovery from relaxation. And they feel, and they have been trained. We all have been trained in modern medicine. If sciatica is there, not recovering because after treatment, medical treatment, and not improving for weeks and weeks together, then we have to do surgery. So they are not wrong in their path. However, they are slightly unconscious about the effects of yoga. And fortunately, because I have been trained in yoga since childhood, I know what kind of recoveries can happen, and that is how I have been treating my patients with the help of yoga. So that he told, at you are quite younger to me, at such a age you have so much of maturity that you are giving a pass to your neurosurgery colleagues. I told, why not, sir? Because if they are not able to understand, it is their life journey and they have not come across yoga. I have come across yoga, that is my luck, and because of that I have been using this in the care of my patients. That's all. That's as simple as that. So he once again congratulated me and thanked me, and then since then he has referred many number of patients for yoga therapy and all these things, and many of them have recovered well also. With this understanding, this is one more, this review is also available, and as you can see that she also recovered, and she has been like recovered after 1.5 years. She has written this review. The thing is that she came back after getting diabetes, and she told that, no, now you treat my diabetes also. Doctor is prescribing sugar, and diabetes diabetes happened after corona came, and because of corona a lot of steroids were given, and because of that diabetes had happened. That also is coming under control now. So there was a Google form which we had filled at the time of this previous lecture when it had happened, and there were many interesting questions, and I had addressed. If VK Sayangar Guruji can do this, if Nannammal can do this at 90 plus years of age, that is the proof that we can preserve our spine, we can preserve our body for a longer duration if we are consistently practicing yoga. The purpose of putting this picture is to motivate all of you to be consistent and conscious of your practice. That is the most important thing. Na hatat, na balat. You should keep on improving. Because Iyengar Guruji had once told, when he was 89 years old, he told in a BBC interview that today I learned a bit more about Shirshasana, and I came to know that there is this muscle which is important for a better posture or for a better balance in Shirshasana. If he can learn and he can improvise at 89 years of age, we are quite younger and we are quite minimal in front of him. So we should not have that, nowadays I am seeing people learn in 2-3 months. They try to do some kind of circus, handstand, headstand, whatever, and then they think that they have done the job. It's not about that. It's about when you enter into the asanam, there is something called as sthiram sukham asanam. So whether we are able to find that stability, whether we are able to find that sukham, happiness, it's not about just doing it off and feeling the pressure, feeling some kind of uncomfortable feeling in the muscles or in the joints. No, that's not yoga. That is acrobatics. Okay, so please remember this. So whenever we are taking care of our spine, we should be understanding that and then doing accordingly. Many of you have met me personally, and we have done yoga together. My emphasis is on relaxation. My emphasis is on improving our awareness while we are doing yoga practice. This is one more example. Shamantaka Maniji, she had improved drastically when she was not even able to walk 10 meters without pain, and she has improved completely till now. No surgery. Even actually, I had advised her 2 surgeries, one in the neck, one in the lower back. She told, doctor, I don't want to undergo surgery. I just want yoga. And she's doing 108 Surya Namaskaras also now. And she's 66 years. Okay. This is one more patient who had improved. See the disc, how much it has come out. She is completely, it is obliterating the passage of the nerve. However, she has improved completely, and she is doing Bandar Konasana. Along with that, she is doing Mayur Mudra. Now, once again, I will stop here and I will demonstrate you Baddha Konasana. Okay. So here you can see, once again, we are utilizing the wall. There is no harm in taking support. There is no harm in understanding our body better every day as we pass our lives. Okay. So here I am sitting with our back completely supported, legs together, back erect, neck erect, hands by the side of the body, and feel the stretch. Okay, relax your shoulders. Everything is all about relaxation, all about becoming more and more aware. Now, folding the right leg, opening it up, folding the left leg, opening it up. So, this is called as Baddha Konasana. Now, not everybody will be able to do this. Okay, so many people may not be able to do this. So, how much ever you can do, that much you do. If you are not able to do, then wait for further flexibility to come through various other practices. Now, another thing is elbow. Elbows have to relax. In the movies and all, they will show like this. No, we don't want any kind of tension anywhere. Just relax. Initially, we can put chin mudra, that is index fingers touching against the thumbs, and try to feel the pulse. Complete. The head also will be touching the wall. Allow the muscles to relax. Observe the changes and breathe slowly, deeply, and smoothly. Observe your breathing. There is something called as asana siddhi. Okay. Various asanams have various siddhi timings. Okay. Means some asana, if you even if you do for 30 seconds, you will be called as siddha for that asana. Now, some asanas like these, maybe even 27 minutes, half an hour, like that also we can think of practicing. So asana siddhi is that point where comfortably you are absorbed into the asana practice and the time of siddhi passes by. You enjoy, you don't wait, oh, when the asana siddhi time is going to be. No. You enjoy the practice and forget about everything about the surroundings and just get absorbed into the practice of this asana. So this is called as Baddha Konasana, initial wall support Baddha Konasana, initial. Okay. Then there is something called as Titli Asana, which we do like this to improve the flexibility of our hips. We can do alternate leg also like this. And then finally, the exact Baddha Konasana, which we do after activating the front part of the body, looking up. And then with straight spine, from the root of the spine, we bend forward. And then finally land our either forehead or our chin, depending upon our flexibility achieved. And just surrender to Mother Earth. Okay. There are various other ways also through which we improve the flexibility of spine in this posture also. Inhale and come back. This is Namaskara. And then this is Prushtha Namaskara. Means going back and doing Namaskara. The hands are behind the back. And then Namaskara. Pressing the palms against each other. Inhale. Look up and then exhale. So if you see, we are all doing practices along the spine, around the shoulder, around the hips. and everything is getting involved. Why? Because we know that shoulder, spine, and hips, these three things are interrelated, and our imbalance in any joint is going to lead to changes in the spine as well. Okay, slowly release and relax in Shithila Dandasana. Okay, I'm just demonstrating today for you to understand that okay, these are the practices which are available. Ideal practices, they start with relaxation if you are having active pain, and then we slowly mold ourselves into the practice of asanas. Okay, so there were many questions which we had done. This is one more practice which I recommend, and I would like to demonstrate this also. Stop sharing and demonstrating. Okay, so this is very important practice, but that this also, like, you have to do in supervision initially, then you can slowly practice without supervision. Initially, if you are a spine patient, then you have to understand directly, and then you can go into the practice. Now my legs are slightly away, approximately 25-30 centimeters away from the wall. My upper body is touching the wall completely, and I am keeping my hands completely up straight, and I am putting chin mudra. Now I am keeping my legs parallel to each other, feet parallel to each other. Inhale and go down gently. Gently go down. Exhale and come up. You will see you will require a lot of effort and your thighs will become stronger. For a good standing posture, we need strong legs. And that is what we achieve through this wall support Utkatasana. This is called as wall support Utkatasana. Release, relax. If you are practicing with me right now, you can share in the comment section. Okay. Now let us move on. There are so many things which were available. One more, this one. This is once again facing the wall and giving that extension of the spine. This is very important. And as you can see, I am doing it in a very gentle manner. I have done it very slowly. I will show you again in this also. I will show you today. Just a second. Oh, my shoulders are still. Okay, Suprabhatam stimulated. Neck relaxation. Very nice. Now we are going to do this whole spine relaxation. Once again, just a second. Okay. I will change this virtual background and we will put something like this. Nervous system. Okay. So once again, I'm going to that wall. That wall is very good for demonstration as such. I hope so. Once again, we go in front of this wall like this, facing the wall, and then looking up, spreading the fingers nicely, and then gently taking one leg back slowly, and then gently coming down. So as you can see, I'm gently giving that extension to the spine. I hope you are able to observe that. And then gently I'm coming down, allowing the chest also to remain close to the wall. Enjoy the stretch. If you feel you can accommodate more extension, just allow yourself to go a bit farther from the wall. This also has to be done in supervision to start with. And then as you become comfortable, slowly you can do it on your own. Slowly inhale and come up. I hope you are able to do it. This also multiple number of times one can do. Okay, previously we had done this one behind, taking your hands behind the back, interlocking them, index finger up. We can do Dvikonasana after the practice which we did in the along the wall. Inhale, look up, and then exhale, bend forward. Keep the legs straight, bend forward, and look up. Like this, hands we are taking up completely. Okay, you can go further down also, depending upon your comfort. Okay. Slowly inhale and come up. This is also very interesting. Those who have balance issues are slightly elderly. Okay, slowly you have to do. Rakesh Kumarji. Clicking noise comes up. Okay. We will discuss this in our Zoom session, and we will observe what you are doing and when we are doing our Zoom session. Okay. Now we will move forward. So this is one more along the wall. Now what I am going to do is I am going to show you, and then like you can see here, like these practices we have done. Many practices we have developed which are very, very simple yet highly effective. Okay. So many chair practices also we have been doing. So you can benefit from those practices also. Simple yet highly effective practices. Now today I'm just going to give you a brief basic anatomy of the spine. You can see here cervical, that is this one. You can see this is called as thoracic curvature. This is called as lumbar curvature, the lower back, and then the pelvic curvature. Okay, this is how the spinal column looks like. In the MRI, many of you would have undergone MRI. You can see here how it looks. So this is cervical, this is thoracic, this is lumbar, and then this is pelvic curvature. Okay, you can see here brain stem, and then brain stem continues as spinal cord. Now, as the theme is back to back, okay, so we will just discuss. This is not my photo, this is somebody else. Okay, but you can see here this muscle is called as trapezius muscle. Okay, this one here, you can see here this muscle which we have. This muscle is called the trapezius muscle. This here, what we don't have as defined as him, but this is called as deltoid muscle. It's a posterior aspect of deltoid. Then there is a muscle called as teres major. Here you can feel it. When you do like that, then there is infraspinatus. You can see in the middle, okay, here in the middle, you can feel the rhomboids upper, like lower. Here you can feel there is a muscle called as latissimus dorsi here. Okay, if you try to contract like this, you will feel. You can feel the latissimus dorsi. If you do like this, and you will feel latissimus dorsi. And then in the center, once again in the lower back, you can feel erector spinae. Okay, you can feel the erector spinae. This is the muscular anatomy of the back. Now, how it is important that we need to understand, that is where I will stop today. We'll keep on discussing in between. I have already discussed many things previously. This is something new I am sharing with you. Not new for me, but for new for you, maybe. You can see here deep muscles, superficial muscles. So the muscles which you are able to feel are trapezius muscle. Here you can feel a bone which is called as spine of the scapula. The whole bone is called as scapula, and on which this humerus, this bone is rotating, okay, along the scapula. Then there is a deltoid, there is infraspinatus, teres major here, minor here, and then major here. And then you can feel latissimus dorsi. You can see here this muscle. Many of you might be able to feel your muscle there. And you can see you can feel your thoracolumbar fascia and then erector spinae. On the side of your abdomen, you can feel external oblique, internal oblique. And here, this is the pelvic bone. You can feel iliac bone, it is called as, and that is gluteus medius. Okay, and gluteus, then maximus, the bigger one. Now, deep muscles are in the neck. You see here in the neck, deep muscle which is attached to the skull. Okay, that is called as splenius capitis, splenius cervicis, levator scapulae. Okay, which will elevate the scapula. Rhomboids minor, rhomboids major. Erector spine means straight, keeping the spine straight. That is in along the spinal column. See here spines which you can feel. Spines. Okay, you can feel different spines. And then along that erector spine, then here you can see a small strap which is going oblique like this, serratus posterior inferior. Okay, which is attaching to our rib cage. If you can see here, rib cage. Okay, so all these things combined together, they are supposed to keep the back as erect as possible and utilize our upper limbs and lower limbs as well in a proper manner. Okay, so muscular anatomy and knowledge about how these muscles move and how we can improvise our movements so that our spine does not get damaged. Okay, so you can see here in between the two vertebral bodies, we have a disc, and that disc many a times pops out, and through which the nerves will get pinched. And then finally, we know that, okay, because of this pinching, we all get some pain, and it is a part and parcel of what do you call aging process. You can see here brain, spinal cord, and these are the nerves. And then we finally enter to skin, muscles, various organs. Okay, you can see here how many branches are like this. So that is how we all feel that burning sensation on the skin, tingling sensations on the skin, because if nerve is pinched here, it will cause problems everywhere. Okay, you can see here how the muscles are attached to the bone. So what will happen whenever the nerve is getting pinched, the muscle will also get irritated, and that is how indirectly the nerve is protecting itself. But unfortunately, it's not protection. It actually creates a lot of spasm, a lot of pain, and at the same time change in the column, the spinal column. The spinal column gets tilted to one side because of one muscle is more contracting as compared to the other muscle. Okay, you can see here the nerves branching out and supplying the skin, the muscles, and all these things. So that is how some people feel, oh, यहाँ पर बहुत ज़्यादा दर्द हो रहा है, muscle एकदम tight हो गया है, पत्थर के जैसा हो गया है. That is all because of nerve getting pinched in between the two bones. And this is how we describe, we understand, we describe your pain If you are telling you have some issue in the thumb, tingling and sensations in the thumb, I will understand that you are having a C6 radiculopathy. If you say that I am having problem in my soles of the feet, then I will feel that you are having S1 radiculopathy, depending upon other symptoms combined together as well. Okay, this I had discussed in a lot of detail previously. If you want, someday we can sit together and we can discuss. Okay, so there are various mechanisms through which there is a coordination between the muscles and the nerves, and because of that we understand where it is going on, and then finally we have to do corrective measures. So how to take care of the spine? One of the most important things is, as you can see here, posture management. Most important is posture management. After that, weight management. If you see here, because of obesity, many of us can increase the stress or the load on the spine. You can see here the joints are getting overworked, and because of that, then over a period of time, the holes through which the nerves pass, they become smaller, and there will be nerve pain. Most important things are in the posture management: how to stand, how to sit, and this I have been continuously telling you over last 685 videos. Okay, how to sit in the chair, how to use mobile, how, and basically we should not walk with mobile and all these things. Okay, see here one more thing: heels, they increase the pressure on the forefoot while wearing, and you can see because of that the spine also gets unnecessary strain. Okay, and the very famous David Beckham's wife, Victoria Beckham, that football player, his wife, she had to undergo surgery because she was wearing high heels. While sleeping, we can relax our spine using the pillows like this, like this, like this. We can put pillows beneath the neck also properly, and we can see here the alignment is extremely important. These are very, very small things, but they will improve the quality of your sleep. Always remember this: the quality of sleep will definitely improve. How to lift weight? Never show that you are a Superman, Macho Man, Spider-Man, Batman. Don't do this. Okay, please lift weight according to how you can and how much you can. Never try to become a hero unnecessarily, and always keep the spine in proper alignment while you are lifting the weight. Do you know this guy, Ronnie Coleman? And after becoming such a huge bodybuilder, now actually he cannot walk properly and he is on wheelchair. His spine got damaged because of excessive bodybuilding. So when we see like this bodies, no, they are actually of no use, honestly. They undergo multiple number of surgeries and all these things: shoulder surgery, back surgery, knee surgery, spine surgery. It keeps on happening with them, and so many bodybuilders, they die in the range of 40 to 50 age because they have used steroids. Their heart is also weak. Their heart is not strong. Their heart is weak. They have overworked their body. Ati sarvatra varjayet. And in Ayurveda, it is told that if you have a capacity of practicing yoga for 1 hour, then always you should practice only for half an hour. But unfortunately, what happens if one has capacity of practicing yoga for 1 hour, they'll practice for 2 hours. Okay, don't do that. Smoking has enormous problems, including problems created in the spine as well. Okay, office syndrome. Many of us work in the offices. We work on table and chair, on laptop. Please do understand that there is ergodynamics which need to be followed, and if we do not follow, we tend to have lower back pain, joint pain, neck pain, headache, and then injury to the eye also. So please go through various manuals on our channel. Also, we have multiple number of times taken classes on these, and we have done eye exercises also for all of you. And in Corona also, lots of spine issues came across because of excessive screen time, lack of physical activity, and domestic violence also. A lot of violence happened, injured each other. So those things are also there. So maintain a healthy weight and diet. Do remain active under a supervision of healthy your health professional. There is nothing called as absolute bed rest in a spine problem. Please do understand, except for some, some exceptional cases. But a degenerative spine disease, you are not supposed to be on the absolute bed rest. Absolute bed rest, if somebody is prescribing you, it means that he or she does not know what exactly spine is. Okay. Avoid prolonged inactivity or bed rest. Okay. Warm up, stretch before physical activities such as even gardening. Okay. Or even driving. I have put a video called as Yoga for Car Driving. Please go through it. It's very interesting and very useful. Maintain proper posture, low heeled shoes, sleep on the mattress with medium firmness, and then unnecessarily soft you should not use. Then do not twist while lifting, and keep your body proper, close to the object where whatever you are lifting. Quit smoking. Ergodynamics of your place of work should be better. And how to avoid surgery. Prayatna, shaithilyam, ananta, samapatti, bhyam. Means with efforts, with practice, if you are relaxing, then you will get ananta samapatti, ananta, enormous benefits. Okay. So relaxation is very, very important. To all my patients who are suffering from pain, I generally give this yoga nidra, and through the practice of yoga nidra, most of you tell that your 60 to 70% pain is relieved. Okay, it is possible with appropriate rest, paraspinal muscles relaxation, corrective yogasanas, pranayam, mudras, yoga nidra, katibasti, grivabasti, which are Ayurvedic procedures that also I prescribe to many of you, and you have all been benefiting from that. Marma chikitsa also. So this is what it is. Many things which we have done, and I request all of you to go through the channel and learn from it and practice it in your life, because at the end of the day, it is practice which will take you to the result, not just reading or watching the videos. Okay, so please do practice mindfully, and please bring your consciousness more and more upwards. Thank you very much. If you have any questions, any queries, I'll be more than happy to answer. I hope that I gave a crisp review of what we can do with the help of practice of yoga, and what basically, structure of spine is: the bones, the muscles, the nerves, and how the nerves get entangled because of our own mistakes, because of our own bipedal posture, and that's what it is. We can prevent it by regular practice of yoga, mindful practice of yoga. If you have any questions, any queries, most welcome. Meanwhile, I will chant the closing mantra, that is Sarve Bhavantu Sukhina. Adopt Namaskar mantra. Om Sarve Bhavantu Sukhinah. Sarve Santu Niramaya. Sarve Bhadrani Pashyantu. Ma Kaschid Dukha Bhag Bhave. Om Shanti Shanti Shanti. With your eyes closed, slowly take your both the hands back, hold your right wrist with the left palm, inhale, arch your back, look up. Exhale, bend from the root of the back, touch your
Forehead to the ground. Express gratitude to Mother Earth Almighty, your parents and Guru. Slowly inhale and come up.
Slowly release your hands, rub your palms against each other to generate heat or positive energy. Keep them over your eyes, head, neck, shoulder, arms, forearms, chest, abdomen, thighs, and the legs. With few blinks, you may open your eyes. Thank you very much, and thank you for joining in. Please share with maximum number of people so that they can benefit. We are conducting live Zoom online classes on Zoom platform, and it is called as Brahma Muhurta Yoga. We are also conducting Zoom classes in Yoga Sandhya, that is at 5 o'clock. These are paid classes. Maybe Saturday, Sunday, I'll be coming live, which will be free. And yes, you can all benefit from these kind of discussions. Today, in addition to being a World Spine Day, today is World Anesthesia Day as well. And today is World Food Day as well. About food, we are going to have a discussion in the afternoon, because I am not anesthetist and I should not be speaking too much about anesthesia as such. But food, definitely I eat, all of us eat. So we have to speak on that. We have to understand more on that. So Mrs. Supriya Khande Parkar will be with us. She is one of our colleagues and she has been doing MSc Yoga. She loves our channel a lot and she has been with us since a long time. So definitely we are going to host her at our channel and we will be discussing. The discussion will be on Yenri channel, YENRI channel, Yenri channel, and it will be around 4 o'clock. That will also be a live session. You are all most welcome. Thank you very much. Always remember that all of us have to be healthy, happy, and prosperous together. None of us should suffer. All of us have to live in harmony and peace along with all other plants and animals. Have a nice day. Dhanyavad.